The government have increased the prices due to a higher tax on alcohol to discourage consumption and prevent alcohol abuse. As it is a price elastic product, this means as the price of alcohol increases, demand of it will decrease. This will mostly affect the youth and young adults, as they do not have the adequate finance to pay for it. Consequently, they may look for cheaper substitutes. Older people, however, already have an established income and will not be as affected as much by the increase in price. In the long term, this gives more money for the government, as demand will rise due to not much choice. This may lead to an increase in infrastructure in education and also allow more money to be spent in hospitals, helping the NHS.
School-based interventions convince kids not to drink. They talk about the risks and they also kind of scare them. The interventions have been shown to reduce the amount of binge drinking. They are aimed at kids with emotional and behavioural problems and have been shown to significantly reduce drinking behaviour. Problems with alcohol start at a young age. These interventions will hopefully convince people to think before drinking. People who are having problems with alcohol will hopefully seek help, or their friends will help them to seek help.
And now onto minimum pricing. Minimum pricing tackles the link between affordability and consumability. In 2012, Scotland decided to act on the alcohol problem and make the minimum price for alcohol 50p per unit. For instance, you could buy 21 units of alcohol for £4, and this was ridiculously cheap. The new policy would make more alcoholic drinks more expensive. For instance, a drink that had 7 units of alcohol would cost £3.50, whereas a drink with 3 units of alcohol would only cost £1, which would encourage people to buy the less alcoholic drink because it's cheaper and more affordable. To be clear, minimum pricing is not a tax. It sets the minimum price that is legal for suppliers to sell alcohol to consumers. This would hopefully impact harmful drinkers more so than family and social drinkers, because it is perceived that harmful drinkers drink cheap, high alcohol drinks, such as cheap ciders and spirits. Social drinkers who go to the pub are usually sold alcohol much above the minimum price, which means they would be marginally affected by this new policy. This would hopefully discourage the consumption of cheap spirits and ciders with high alcohol content, which would reduce the affordability and consumability of these products. Problem drinkers would be less able to buy these drinks because they're less affordable, and hopefully become less of a problem in the community because they are less able to buy cheap alcohol. Minimum pricing has many benefits. For instance, in the short term, it could lead to happier, healthier, and safer communities because problem drinkers would be less of an issue to the community. However, most of the benefits come in the long term. For instance, alcohol-related deaths would decrease. For instance, it is predicted that alcohol-related deaths would fall by about 60 in the first year and 318 by year 10 of the policy. There is also a predicted fall in crime volumes by about 3,500 offences per year. However, most of the benefits come from in the long term. In the long term, there will be a decrease in alcohol-related deaths. They are predicted to be a fall by about 60 in the first year and 310 by year 10 of the policy. There is likely to be a fall in crime volumes by about 3,500 offences per year, and a definite financial saving from harm reduction in areas such as health, employment, and crime of 942 million over 10 years.
Now let's talk about drink driving and the possible effects it can have to curb alcohol consumption. The three ways to counter drink driving are laws and regulations, enforcement of these regulations, and education about the problem that society is presented to. In 2012, 25,580 people died due to car accidents in the whole world. 32% of these accidents were caused by alcohol and drink driving. 16 to 24-year-olds were responsible for 35% of alcohol-related accidents in the USA in 2012, when they only represent 14% of the population. These shocking figures prove the deadly effect alcohol can have on society. The main legislation concerning drink driving is the regulation of the blood alcohol concentration, called the BAC. In most countries, the maximum rate you can have whilst driving is 0.5 milligrams per milliliter in your blood. As you lower the BAC threshold, people are less likely to drink and drive, and therefore less accidents are going to happen. This could also reduce the amount of alcohol being consumed at bars and clubs. To enforce this, random testings are set out and sanctions are created for people driving over the limit. There are stringent sanctions for repeat offenders and getting caught with a high amount of alcohol in your blood. These punitive measures go from paying a fine to going to prison. They create some sort of pressure on drivers, especially young people and repeat offenders, due to the high degree of the sanction. In addition, these people are the main groups of consumers that drink alcohol, and therefore this will have a heavy impact on the amount of alcohol consumed. Education about alcohol to increase the awareness of the population can be done through media campaigns created by the government or by school-based interventions. These campaigns could be very effective to influence people to drink in moderation and also be more responsible when going out to pubs or bars. Therefore, the population would consume less alcohol and we would see less binge drinking. The effectiveness of these policies depend on many different factors. The amount of police force used to random test drivers would influence the uncertainty of drivers that drink and drive. The severity of these sanctions would complement this pressure and really limit the people that would be willing to take this risk. Finally, the willingness of the government to invest a lot of money in this campaign would change the whole attitude of the population about alcohol consumption. In conclusion, drink driving includes aspects of alcohol abuse, underage drinking, and leads to car accidents. On the short term, the sanctions which pressure people to drink less could be efficient. But in my opinion, the long-term education of children and the society as a whole would be the best way to decrease the consumption of alcohol.
The best policies to decrease alcohol consumption are school-based interventions and minimum pricing. School-based interventions tackle problems before the addiction, and minimum pricing affects people who are already addicted.